Hello everybody, my name is Michael Freeston, Director of Quality Improvement at the Early Years Alliance, and it's my pleasure to welcome you to this webinar this evening, Early Years Update, the Essential Webinar, January 2021. It's my pleasure this evening to be joined by Melanie Pilcher, Quality and Standards Manager. Please say hello, Melanie.
Good evening, everybody.
And Shannon Pite, Press and Public Affairs Director with the Alliance.
Hi, everyone.
Smashing. Welcome to January, I think is probably where I'll start. Hopefully you can see my screen, which gives the introduction slide. My role today is to act as chair and to take your questions and weave them into the presentation that will be given by Melanie and Shannon, and to try and draw from them any information that is specific to your circumstances. What we wanted to try and do was to take stock of the sheer volume of information, guidance, regulatory changes that have come about in the last 3 or 4 weeks. Obviously, all of this is in the public domain, but we just thought it would be an opportunity to talk it through and then give consideration to what these actually mean for practitioners. So this is an opportunity to share the circumstances you're facing. My role is to try and draw those into the discussions that Melanie and Shannon will be having. Obviously, there are certain things I probably can't answer. If there are specific questions that floor us all, we will try and take them back and I'll get them answered, whether that's through Ofsted or the Department for Education or anybody else. But please bear with us. We are well informed and have good channels of communication, but we are not oracles. So if there are things that we don't know the answer to, we will just say so. Hopefully I can move my questions across onto this sleeve there, and that does not affect what you can see. If I just work through, if I can get the slides to move, there we go. For those of you who've been with us before, you know that we don't generally demonstrate, we don't have webcams operating because we find it increases the bandwidth hugely and makes the recordings very hard for people to download. But just to give you a visual representation of who we are, there's the three of us. We'll be taking you through today's session. And the aims of the session are to highlight the most recent updates from the government and from Ofsted, to summarise the latest information and reflect on what this means for you and for your practice, to advise on how and where further advice can be found, and importantly, to step back and remind ourselves why we are here and why we do what we do. So without further ado, first one, see my fingers are rolling too quickly. Without further ado, I shall hand over to Melanie, who's going to take us through the first series of slides and the information relating to Ofsted and regulation and inspection. Melanie, please.
Thank you, Michael. Well, as Michael has just explained, what we're trying to do really in this session is just pull together some of the most recent updates and to give you an overview of what's going on, what's changed and what's new. But also, again, as Michael said, to seek clarity on your behalf when we need to. So I'm just going to start off this evening then with just a few bullet points here from Ofsted's rolling update, which I hope you all access on the gov.uk website. So looking at where we are, Ofsted, as you will know, have maintained their regulatory response throughout the pandemic, but they have had to adjust that activity to focus on 3 prime areas. Firstly, any provision that causes concern, because they still hold that responsibility for compliance and enforcement. They are aiming to register any new provision and have done throughout the pandemic, and to fast track the application process and to support the expansion of existing provision, again through fast tracking the application process as above. Now, the last few weeks with regard to assurance inspections, things have changed slightly several times. our last webinar, we did focus on assurance inspections, what they would look like, what they would contain, and when they would start, which at the time was going to be the beginning of January. Since then, of course, we've gone into lockdown, and those assurance inspections have now been postponed until after February half term at least. Ofsted still plan to resume the scheduled inspections from summer term and from after February half term. Until then, those assurance inspections will take place. Ofsted also confirmed that childminders will not receive assurance inspections. Now, the rationale for that is mainly the fact that childminders are under huge pressure where they may have family members that are working from home. They may well be homeschooling their own children. And of course, having an inspector into your home environment at a time when we're supposed to be trying to reduce risk is just not a good idea. So I think we can all welcome the fact that childminders will not be getting those assurance inspections. And
Melanie,
a few
just
weeks
to
ago,
go on to the last
yes,
point, sorry.
yes, of
I've
course.
just had a couple of comments in terms of sound, and it's come from a couple of people, but I just want to check with everybody that they can all hear. It's just a couple of people. Just to see, would people mind putting a comment into their box to make sure they can see your slides? I can hear. I'm afraid in that case then, Nikiru, it is just you. Thank you.
Yes.
And you can all, that's reassuring. That would have been problematic. Sorry, Melanie, back over to you.
No, absolutely fine. I mean, it's a really stormy, blustery night out there, and you know, I'm sure a lot of people will be having problems with broadband and so on. But be reassured as well that you will get this copy of the presentation. You can access it on YouTube, where hopefully the sound will be clear, so it'll make up for any bits that you do miss. So where we just left that then, I was talking about childminders not receiving their assurance inspections, and Ofsted have also updated their deferral policy to include that in some circumstances, should you be alerted to an assurance inspection or your scheduled routine inspection from summer term, in some circumstances you will be able to request deferral for circumstances that are related to the pandemic. So just bear that in mind as well. Okay, Michael, if we can just move on again. Thank you. The other thing, there's been a couple of changes recently to the disapplications and modifications, or perhaps I should say a couple of updates to them, because as we know, the disapplications and modifications will remain in place until August the 31st, 2021, for circumstances related to local or national coronavirus restrictions, and we need to be very clear about that. Once those restrictions at the time have been lifted, you will then have a 2-week transition period, during which time you must revert to delivering the EYFS in full. Now, the latest update that we had on paediatric first aid certificates are those that have expired on or after the 1st of October 2020 will now remain valid until the 31st of March 2021. And that again is where you have been unable to renew your certificate due to circumstances linked to the current pandemic. After that, you must obtain a new certificate. The progress check at age 2, at one point we were being told that practitioners should still undertake that. The circumstances at the moment are that the progress check at age 2 will not need to be undertaken during any period of intervention related to the pandemic. But Ofsted do say that providers should make best endeavours to do so where they can. And the same thing applies to the early years foundation stage profile, although of course that doesn't affect many of us in the early years sector. So during any period of intervention related to coronavirus, early years providers should use reasonable endeavours to meet those learning and development requirements, instead of this being something they must do. So where you do disapply or modify the EYFS for the circumstances or in the occasions that you can do so, you must be able to justify why you have done that. And you must also be able to show that you have made reasonable endeavours to fulfil the requirements in full as and when you can. Okay, so if we just move on again, Michael.
Oh, sorry.
That's okay.
Just a question
Yes.
about first visit, regulation visits, Melanie, in terms of, we had a question from Mary saying that her setting was inspected, previous one, but has moved premises in September 2018, but no registration visit yet. You've talked in terms of sort of ongoing
Yes, yes.
visits. What about registration visits?
So Ofsted will certainly be prioritising those settings that have not received a visit since their registration. That is one of the areas that they will prioritise for the assurance visits as and when they do take place. And one of the other things that Ofsted have also said, and I'm just trying to find my notes here because there's quite a few things, the inspector may ask the provider in some circumstances to share more electronic evidence than usual. This might include photographs of premises such as repairs and decoration. So where you are still required to notify Ofsted of changes to the premises, Ofsted may well ask you for other evidence actually to support that. So, and that may well be electronic evidence. It might be updated policies, it might be updated action plans, it might be staffing lists to confirm that you have enough staff to open, and it might be staff training records. So just be aware of the fact that Ofsted may well ask you for additional evidence should they plan to come and do an assurance visit, or should they need to contact you because they have concerns about your provision. Okay,
great.
That's fine. And the other thing I wanted to just focus on as well for a moment is safeguarding, because one of the things that Ofsted will do when they undertake an assurance visit is that they will make a separate judgment on safeguarding. Now, this isn't the normal outstanding, good, requires improvement or inadequate judgment that we would have in a routine graded inspection. This is for any assurance inspection, you're either meeting the requirements or you're not. And the same thing will go for safeguarding as well. So one of the things that I wanted to just flag up with you on that is that you may well want to consider whether you need to refresh or review your policies and procedures or any child protection arrangements in light of the pandemic, including any period of intervention related to coronavirus. You must still have a practitioner designed to take lead responsibilities for safeguarding. So you must still have your designated person for safeguarding, but it is acceptable for them not to be based on site if it's not practical. And during an assurance inspection, as I just said, a judgment will be made about the effectiveness of safeguarding. So some of the things that I think you need to be thinking about here is how you can demonstrate that you have acted upon any advice from your local safeguarding partners, because naturally you'll want to know what's happening locally and you'll be wanting to take on board that additional advice. Similarly, for local authorities, any updated advice. Reiterating what staff and volunteers should do if they have concerns about a child, because obviously with staffing levels at the moment, people being off, people at home self-isolating, some of those roles and responsibilities may well have changed in your setting. So just make sure everybody's clear about who does what. And then just finally, any arrangements that you have in place to support children for whom you are concerned, either in the early years setting or those children that aren't actually coming into you at the moment. And what arrangements do you have in place to keep those children safe or to maintain contact with those children, particularly those who are vulnerable or that you were worried about previously? And so lots of things there from Ofsted and from the DfE at the moment. So I think that's all I wanted to say. Obviously, we'll take any questions as we go through. But at this point, Michael, I'll hand you back to Shannon.
Thank you. Conchita has asked, if there is a management change, could that cause a visit or contact by Ofsted, i.e. to the managers and deputy or co-managers? How does that work in terms of the priorities?
Yeah, it may well do, but again, Ofsted are risk assessing all their activities at the moment. So if they believe they need to contact you and ask for evidence or speak to you remotely, then they may well do that. But it's all based on that risk assessment approach at the moment.
Okay, thank you very much, Melanie. As Melanie indicated, moving on to changes from DFE, Shannon, please.
Hi, thank you. I get the funding section. So I wanted to start with an overview of earlier census changes. Hopefully most people are aware of this, but just in case I thought it'd be useful. So as you're probably aware, in the autumn term last year, the government was funding local authorities on the basis of census figures from January 2020. So basically how many children were attending earlier settings before coronavirus, to provide that support to the sector. I should caveat that with, I'm aware that not all local authorities were passing that on in full, in kind, but the principle from the government was that they would fund on pre-COVID levels of attendance. At the end of last year, they then said in the spring term, because things were getting back to normal and attendance levels were gradually rising, they were going to go back on to funding on current attendance figures. So they were going to base funding this year and this term on the January 2021 census figures. Then, of course, national lockdown happened and a lot of providers were left in the very scary position of being told by their local authority that they were going to be funded on actual attendance at a time when government was telling people to stay at home wherever possible. So the Alliance, alongside other sector figures, called on the government to continue funding on pre-COVID levels as they had done last term. So what the government has announced last week is a kind of halfway house. So they still intend to fund based on January 2021 census figures, but they've clarified to providers and local authorities which children can be counted in the census. So it's not the case that it's only children who are physically attending a setting. So if you are a provider who is either open or has been forced to close, and forced to close means something like you don't have enough staff due to self-isolation or sickness, or you've been told to shut down because of an outbreak, or your landlord has said you can no longer access the premises, then you can count children who are not only just attending, but are also registered at your setting and would attend if they could. So for example, if a child is sick or self-isolating, but also importantly, if a child's parent has decided to keep them home, that counts, you can still count that child. And the basic principle from the DFE is if that child wanted to take up a place in your setting today, would it be available to them? And if it would, that child can be counted on the census. So that provides some reassurance to those providers who had been told they were going to be funded on actual attendance, but it still falls short of funding the sector on pre-COVID levels, because you might be a provider, for example, who in January gets a whole spate of new registrations and new interest that hasn't materialised this year. So you might still be hugely down on your pre-COVID income. So that's where we are for providers who are either open or have been forced to close. If Michael, you don't mind going to the next slide, we can talk about. Oh, yeah.
Sorry, Shannon, there's a bit of a delay when I start talking, my apologies.
No,
just to give a practical example of that, I've had a question from Celia. Hertfordshire have been really supportive and forthcoming with advice and funding. However, for settings who are not opening normal hours, i.e. they're reduced or only key worker children, should those settings still receive full funding for children who would have been attending in the spring term? So that's back to your paragraph on there, I think.
So my
that's
next slide.
Exactly it, isn't it? Oh, your next slide.
So
See? Oh, my apologies.
Yes. No worries at all. It's a good question. It's a very valid question.
You preempted us already, Celia.
No, yeah, that's a very good question. So for providers who have either chosen to close fully or limit places, the situation is different. And again, it links back to that principle of counting children who could take up a place if they chose to do so. So given that example, if you were a provider who has chosen to open to key worker families and vulnerable children only, then the guidance that I've just summarised only applies to those children, because if those children want to take up a place, they can. If you have a non-key worker child or non-vulnerable child, what you're saying is the place isn't available for them at this time. And under the government guidance, that means they cannot be counted in the census count. Similarly, if you're fully closed, then no children can take up a place at this time, which means no children could be counted on the census count. If a child is reducing hours, then the hours that are available to them is what's counted in the census. So if you receive our email updates, there is a link on our website, which I'm sure we can circulate out the slides, that has the full detailed guidance on which children can and can't be counted in the census. But essentially it's, can the child take up the place today? And if they can, for however many hours they can, that can be counted. Yeah. And if they can't, it can't be counted.
Okay.
Hope that answers the question. So
that really does. Thank you. You can imagine there's a few things that have come in on this one, and I'm trying to work them through because there are some that are themes. And one's a specific HR one here, so I think we tread carefully in what we say. It's a question from Stephen. Our staff are refusing to work because of the risk of coronavirus, and so our setting is closed. How does this affect our funding? I assume we're back to your slide here.
It's a good question, actually, because the guidance covers situations of staff sickness and staff isolation, but it doesn't cover a situation where staff are refusing to work. So it's one I would prefer to take back to the DfE rather than hazard a guess at an answer. But it's a very good question.
Quite right. Thank you, Stephen. That is an interesting one. Something about charging for parents. If we normally charge an extra cost for the additional 45 minutes for lunch, should we still be charging parents for this? From Nicola.
Could you repeat that, Michael? Sorry, it broke up a little bit.
It's around charging of parents, and this was charging parents for the extra 45 minutes for lunch. And is that payment still a legitimate charge?
Assuming the parent is still attending and the child is still taking up the place, I can't see any reason why it wouldn't, unless I've misunderstood the query.
Yes. No, I think that was my interpretation as well. So I think hopefully that's the case. I'm trying to read them very quickly here. Shall I move the slide on, and then I shall come back and weave things in if I can?
Okay, so I'm going to move on to the next slide. Okay. I can carry on.
Funding and furlough, yep, okay. Are we there? Yep. Can you see it? Great.
Yeah, so that's fine. So this is to clarify on how those providers who receive a mix of private and public income can calculate how much support they can get from the job retention scheme, because it's changed from the original guidance. So I always find it easier to explain furlough because it's horrible, using just an example setting. So I use a setting who has a monthly income of £10,000 and £4,000 of that, so 40%, is government funding, and £6,000 of that, so 60%, is private income. First point to make on the new rules is that normal income no longer needs to be February 2020 income. The old rules stated that you count February 2020 as your normal income because it's kind of like your pre-COVID income. The government has now given some quite vague guidance to say that you can give whatever could reasonably be said to construe a normal income as your normal income. And that's as much detail as they've given. They've not kind of given any guidance as to what might be a reasonable way to do that. So the old rules say that whatever the percentage of your total income was made up of private income, that was the same percentage of your payroll you could apply furlough support to. So for our example setting, 60% of their total income came from private fees, so they could apply furlough support to 60% of their payroll. Those are the old rules back in March, April last year. The new rules are, and please bear with me, I hope it will make sense when I do the work example. Just hold on in there. What is your current, you look at what your current early entitlement funding is as a proportion of what you're saying your normal income is. And that's the proportion of your payroll that's not eligible for furlough support, which means the rest is eligible. So using the example, let's say your government funded income has fallen from 4,000 to 2,500. 2,500 is 25% of your normal income of £10,000. that means that 25% of your payroll is not eligible for job retention scheme. So that's the bit you kind of put aside saying, I can't claim on that. It means the rest of your payroll, 75%, is eligible for furlough support. So you can see there the amount eligible has gone up from 60 to 75. If, for example, your funded income fell to £1,000, £1,000 would represent 10% of your normal income of £10,000, which means theoretically the rest, 90% of your payroll, would be eligible for furlough support. And the reason I say theoretically is because depending on how much private income you've got coming in and how many private fee-paying children you have coming in, you might not be able to practically furlough that many staff, but theoretically that's the limit on how much you could apply furlough support for. I can't see the questions, but I dread to think if any are coming in, because I know it's a bit...
I'm still trying to make deal with the ones that are about the temporary absences. We'll get onto the furlough ones in due course, Shannon.
Okay. So that's my furlough summary. I will try and come back to questions as and when they're put to me, but that's the situation at the moment with furlough.
Right. I've had a whole, thank you, Shannon. That's fascinating. I've had a whole lot of questions in terms of the temporary absence. Okay. I'll take a few, but I think so many that we'll take them offline and we can respond because we can download these in due course. So if people don't mind, there are things to which, most of which I think are probably covered on our Q&A sites that you've been updated on the websites, but obviously people are asking it from their particular settings point of view. And so we can take those offline. One thing in terms of staff around, I have several members of staff, this has come from Becky, who say if they are not allowed to wear a mask, they will not work. They work with 2-year-olds. Are staff allowed to refuse to work? Am I allowed to say? Now, I don't want to put you on a spot if you don't know, and we can take this to our HR department, but I thought it was an interesting question in terms of balancing staff safety and employers' responsibilities.
I think it would be one for HR, or if Becky, if you're a member for Law Call, a 24-hour legal helpline that can help in such queries, just because the DfE guidance doesn't cover that. The guidance says in the DfE that they don't recommend that staff wear masks in settings with children, but they do allow for the wearing of masks in communal areas where adults can't socially distance, such as corridors. That's as far as the DfE guidance goes. So anything further than that from a kind of HR perspective would be a HR query. So it'd be better either a HR colleague or Law Call to support with that.
Okay, thank you very much. Right, I've got a couple of furlough ones. I'm just dipping in here. We've got loads. If I don't address to the colleagues who are sending in their questions, we will take these offline and try and make general responses, probably as a general circulation to everybody who's attended. But there's a couple ones here in terms of, I'm just going to pick at random. Do you have in your example mean that we furlough 6 out of 10 staff, but still pay the other 4 80% from our reserves? From Vince. Now,
so I'm gonna no, it makes sense.
Yeah.
So the number of staff depends on what the staff earn. It's really awkward. So you look at your payroll as in how much am I paying on salaries. If you start from that perspective, not looking at staff members, because what it is if you calculate 60% of your payroll in the old example, for example, you might not have an even number of staff that add up to that exact amount of salary. So what we have in the early is we suffer from is leftovers. So you might have, I don't know, you say, okay, I've calculated that £8,000 of my payroll is eligible for furlough support, but I don't have any staff members whose wages add up to exactly £8,000. They add up to either £7,500 or £9,000. So what it would mean is you could only get that support on whichever staff members add up to £7,500, and you just lose the extra £500 of support. It's a real flaw in the system. And then the idea is that, yes, the other staff's wages are being paid out of your normal funded income, so that pays for those staff and the furlough supports the other staff. Whether or not you pay full pay or 80% would be dependent on if you're asking the staff to work. Obviously, you'd pay them full pay. If you're asking them not to work, I think, again, Law Call has advice on whether or not you could say you're not technically being furloughed through the furlough scheme, but we're applying a similar scheme and using early years funding. So again, hopefully you remember, and I'd recommend speaking to Law Call on that, because I think they've got some guidance on it.
There are some fascinating questions coming in, but I think they're so specific, we'll take them offline. There is one about payment from paying parents. If the paying parents are choosing not to attend due to COVID and we are open, should we be charging them?
Right. So the Competitions and Markets Authority has issued some guidance on this. So essentially, if you're, I know this doesn't answer the question straight away, but I promise I'm coming to it. If a service is not being offered, so for example, during lockdown last year, then providers shouldn't charge. If a service is being offered and a parent is legally hindered from accessing the service, so for example, they have been told by Test and Trace that they cannot leave the house, then the CMA says, and this is the CMA, not the DfE, says that the guidance is that providers should not charge for that service. Now, whether or not your parents are willing to do so, and I say this, I have a nearly 2-year-old in nursery who has had to self-isolate twice, and I would never think to ask for any kind of refund. So if you can come to an agreement with your parents and they are happy to pay, or there's some kind of middle position, that is fine. You are within your rights to come to that kind of agreement with parents. It's not a black and white position that the CMA says it, so that's it, regardless of what the parent thinks. If a parent has just decided, I don't feel comfortable coming in, it is our view that that does not match the CMA's guidance, because the government guidance at the moment is that early year settings are safe to attend and are open to all. So they are not hindered from attending the early year setting in the same way that someone who's been told by Test and Trace to isolate is. So the CMA guidance does not appear to apply to that situation in terms of prohibiting providers from charging. I'm trying to be very specific and not give advice, but just but explain what the guidance says and doesn't say, if that makes sense.
Absolutely right. Colleagues will remember that there was some criticism, although there were referrals to the Competitions and Markets Authority during the first lockdown in terms of what was appropriate in terms of charging, and hence the reason why I think Shannon is being extremely careful with her wording. Thank you, Shannon. Shall I move us on? Again, for those people who are asking specific questions, we will undertake to take them offline and get responses as best we can. Thank you. I'm trying to move the slide. There we go.
So we've received a lot of queries about the scientific evidence behind the decisions of the government to ask early years providers to remain open while asking primary schools, secondary schools and colleges to close. I would like to preface this by saying that the Alliance is of the view that the evidence that's been provided is woefully inadequate. So I don't include this to defend the evidence given by government or to say that it's sufficient, because we don't think it is. But I thought it would be useful to share what has been said. I've highlighted 3 key points, and what's on the screen is an answer given by Children and Family Minister Vicky Ford to a parliamentary question asking about the decision, because they're some of the points that come up a lot when the government's talking about this. One talks about preschool children being less susceptible to infection, and another talks about under 5s having a low confirmed case rate, and another talks about early modelling from SAGE showing that early years provision has a smaller impact on transmission than primary schools, and primary schools have a smaller impact than secondary schools. And I think the key thing is to point out here that we have continued to point out and continue to point out to the government is that there's a lot of focus on whether or not children get the infection and children get ill. And I think it's been pretty well established that very young children get very low rates of infection, and that they get much less severe forms of the infection, often asymptomatic. What isn't clear is how this affects staff, how at risk staff are, and in particular in light of the new variant of COVID. So the early modelling from SAGE was based on the original form of the virus, and we don't have sufficient evidence on the new form of the virus, whether or not it is still the case that early years is safer than primary, which is safer than secondary. And of course, there is the concern that because young children are often asymptomatic, and also because doing a test is quite unpleasant, children aren't getting tested so frequently, so they are seeming as if they very rarely get COVID, but actually they could be getting it a lot more often. This is something that we're continuing to raise to ministers, to MPs, to SAGE. I'm very aware that the sector and many in the sector do not feel comfortable with the evidence base that's been presented to them, and we share those concerns. But I thought it'd be just useful to show what is being said at the moment and where we think the gaps are.
Thank you, Shannon. That's really helpful. There's an interesting one here. It's coming from Rebecca. Just a comment. Many of our parents will not put a child through a test because it is invasive. If they have tested positive, the child has too. So knowing that, the data cannot be accurate. There is that issue in terms of the availability of the scientific evidence.
Yeah, it's something that was shared with me again today about a provider getting a lot of reports from parents saying, we're pretty sure the child's got it, so we're not going to do the test, we're just going to self-isolate. So of course they're not getting picked up in the rate. So it's a very valid point. Yeah, I would agree with that.
There is a question here, and I've considered it from Vicky. It would be interesting to know how many early years staff have contracted the virus. Is that, I'm guessing that information is not collated, because I don't think it is even for schools. Is that correct?
It is something we are looking into and will be referenced in an upcoming slide. So
oh, right.
it's not out there.
Shall I move this on?
But it's en route. So yeah, so it's coming up. Yeah.
Can you see that?
You, Michael, if you're speaking. So
oh yeah, no, I wasn't
speaking.
speaking.
Yeah,
Has the slide moved on?
That's fine. Yeah,
no.
I can see the slide. Mass testing.
Yes,
I can hear you.
Great.
Okay, so testing. Where to begin? So as you may be aware, there are two types of COVID tests: the test that you take when you have symptoms, and asymptomatic tests, also called lateral flow tests, which are tests that you take when you don't have symptoms, and they return a result a lot more quickly. The Department for Education has rolled out these asymptomatic tests in secondary schools and colleges, and had said it was planning to roll out the same tests in primary schools and early year settings. And we were very excited and thought, for once the sector has been included in the department's plans, thank goodness. Then the announcement came that it was primary schools and maintained early year settings, and that private and voluntary providers would instead be prioritised for community testing. So that is the nationwide rollout of asymptomatic testing in local communities. So I've got one near me that's in a theatre hall, and another it's on a kind of old farm. So what this means is private and voluntary early years providers are now going to be required to travel, sometimes far distances, often during working hours, to get these asymptomatic tests, while their maintained colleagues are getting tests delivered directly to them to take at home. I've worked at the Alliance for, I think, 8 years now, and I don't think I've ever seen as much outrage as I have with this announcement. It's appalling. There's no excuse for it. All providers should be treated equally, and it is something that we are pushing so hard with the government. And I know yesterday Children and Families Minister Vicky Ford said that the DfE are working on more direct testing for PVI providers, I think because of the absolute volume of outrage that the DfE has rightly received on this. So it is an absolute priority, but I just thought I would provide an update on it because I know it's a question that comes up a lot, and I think there is a little bit of confusion over symptomatic testing and asymptomatic testing. So when we talk about mass testing, that is for staff members who don't have symptoms, and it's trying to pick up that asymptomatic viral spreading that we know is contributing so much to the spread of COVID.
Thank you, Shannon. As people know, I'm a seasoned webinar chair, and I'm completely overwhelmed by the comments that are coming in. They're scrolling up through my screen so fast. People seem to be share your indignation, and I'm really losing track of what is there. So for everybody who's typing, I do apologise. It is my I can't read quickly enough, but the indignation you have suggested, Shannon, seems to be shared. Shall I move us on?
Yeah, that's fine. And obviously I would say to anyone that's, if they're putting comments in, that we will look at the comments afterwards. So if there's anything that needs to be picked up, that we're not picking up because of the sheer volume, it won't be lost. We will look at overall comments after this session. And the next point was vaccinations. So as people may be aware, the phase 1 of vaccinations has taken place at the moment, and it's based on those people who are most at risk of hospitalisation and death from COVID-19. So that's listed on the screen, points 1 to 9. I think we're just this week starting on point 4, which is that those over 70 have been invited to take tests, although it does differ from area to area, depending on the supply of vaccinations. As the DfE is at pains to say, if you are an early years provider who falls into any of the first 9 categories, for example, underlying health conditions, or if you're over 50 years of age, you would get your vaccination as part of phase 1. However, what we're focusing on is phase 2, which is the next step. And I heard someone from the Joint Committee of Vaccination and Immunisation, the JCVI, and they're the independent group that decide who gets vaccinated, basically, on BBC 5 Live today, saying that there might be a slight overlap with the phases, and as we're kind of getting to the end of phase 1, we can start doing phase 2. And one of the areas that's been looked in for phase 2 is looking at occupation, and basically who's at risk of contracting COVID because of their occupation. And of course, we are doing a huge push for the earlier sector to be a priority for vaccinations. The DfE have said to us that they are pushing for the early years to be a priority even within the education sector, on the basis that the early years is the only part of the education sector that has been asked to remain open. I've made the point at DfE meetings that it would be nice if the DfE could make it a bit clearer publicly that that was the case, because I don't think that the earlier sector feels that the DfE is shouting for it on its behalf. That's what they've reassured us that they are doing. But in essence, we are very much pushing for vaccinations to be given to early years providers as a priority. It is important to note that as it stands, the evidence is that vaccinations stop you from getting seriously ill from COVID. It is not clear yet whether or not it stops the spread of COVID. So what it means is you could be an early years practitioner who's been vaccinated, but gets COVID, has barely any symptoms, but has an asymptomatic test, and it turns out you've got COVID, and that would still mean things like closing bubbles or things like that. So that issue that providers are having with, say, for example, staff absences, vaccines wouldn't actually necessarily solve that. What it does is protect the workforce from getting seriously ill from COVID, which of course in itself is so important. I don't know if there are any more questions on that one.
Oh, I'm trying. The comments in terms of personal experiences in testing, attitudes of parents, etc. So I'll move us on. I will try and bring some back when we've finished with the information, Shannon. So
okay,
please.
No problem. I'm getting to the end, so hopefully there'll be a good portion of time to kind of go over those questions. So I just wanted to quickly update on what the Alliance is doing to try and speak for the sector, or speak out for the sector, and to represent the concerns that we're hearing. One of the things we've done is we've joined up with NDNA and PACey to launch a joint campaign called Protect Early Years, and it's really to address basically the issues that we've been talking about so far in my part of the session today. So it's about getting clear evidence on the risk implications of early years staying open, prioritising those working in the early years for phase 2 vaccinations, the rollout of mass asymptomatic testing, direct settings, the reinstatement of early entitlement funding at pre-COVID levels, and also funding for providers who are more reliant on private income who have suffered from falls in parental demands. So hopefully that kind of encompasses the main areas that those in the sector are concerned about. I can go to the next slide, just trying to whiz through so we can address the question. So as part of the campaign, hopefully this looks familiar to some people, we have a template letter for MPs, and it's just a quick form where you can fill in your details, put in your postcode, and it automatically works out who your local MP is. You can also put in your own personal views on the need to protect earlier settings, both practically and financially, and it adds this to a kind of template letter and it goes off to your MP. One thing I would say is I often get emails from people who have written to their MP and it's either been ignored or they've got this template email back that's clearly not personalised. It's still worth doing MPs do get a lot of mail, so a lot of them do send out these really impersonal standard templates. But if they are getting hundreds upon hundreds of local constituents, parents and providers, because we do have a parent template, emailing them about this, it does build pressure. And as I say, in all my time in the early years sector, I've never seen the early years so rightly outraged, but I've also never seen the early years spoken about so much in Parliament. There were, I think, 4 parliamentary questions published today, all to the Children and Families Minister, asking about, I think, testing. Why aren't early years providers, private and voluntary early years providers, being tested? In education, questions on Monday, which is normally always all about school. It's an education debate in the House of Commons, and it's always about schools. There was question after question about the early years sector. So please don't feel disheartened if you've contacted your MP and they've not responded very well. It really is worth doing it if you haven't done it, to continue building this pressure. It does, behind the scenes, it really does make a difference.
Thank you, Shannon. Before I just move it on, because I'm losing track of it, I've just had an interesting point from Ashley. There's been a lot that's come in, and I think this is a question for Melanie as well as Shannon. We have a family who completely ignore all of our policies and procedures for COVID and are clearly not sticking to household bubbles. We've seen through their social media, etc., others and other parents telling us. Is there anything we are able to do to protect our setting children and the setting from this, i.e. telling them that we cannot allow them to use the setting? A point for consideration by colleagues and attendees, please. That is an issue.
Yes,
it's an ethical one.
Yes, it absolutely is. The only thing that I could say with any certainty is that I would hope that in your terms and conditions that you have with parents, that one of the things that you would always say at any time is about the importance of adhering to the settings, policies and procedures in order to protect all of the children in the setting. So unless you have amended or altered these in any way, shape or form to sort of cover the current situation, I think really it's just having those conversations with parents and making it very clear about why you're doing this and the policies and procedures that it relates to. Shannon, do you want to add anything to that?
I think that covers it, Mel. I don't think there's anything from the DfE in terms of those interactions. So I think it would be, as you say, a direct conversation with parents, and where applicable, the settings own policies and procedures. I would agree with that.
Absolutely, thank you.
Shannon, just to show the impact, a couple of comments from Anne Laws. Our local MP Zoomed us from Parliament last week, and we're having another Zoom meeting on Friday. It's well worth writing. And she said the name is Liz Twist, Bladen MP, has been absolutely brilliant. We have another with her, so it's a useful name to keep in our back pocket, I think. Shannon.
We are constantly in contact with MPs, so that's really useful to know. And thank you, Anne. Well done to you for being so proactive, because it does make such a difference.
Okay, thank you. Sorry, I'm losing track of it. Where am I? Are we with Shannon? This is still Shannon.
Sorry, Michael.
Oh, sorry. The joint survey with Cedar.
Yes, so this was in relation to the query that came up before. I'm so sorry, I can't remember the practitioner's name, who asked about cases in early years settings. So hopefully you've seen this email that came from Neil last week or this week, if it was a chase up. Essentially, we're partnering up with Cedar, who are independent sector analysts, to do a survey which closed midday yesterday, to look at both both of safety and also issues of sustainability in early year settings. And one of the questions we asked was, how many cases have you had in your setting, both staff and children? We are going to be releasing the findings tomorrow. In part, we have ITV covering them, and then on Friday more widely, and that will look at the level of cases amongst the early years workforce and see the estimates on that. So that, as Michael rightly said, it's not information that I'm aware that's been gathered yet, and there's been so much focus on early years being low risk environments for young children. So what we wanted to do was look at what it meant for the workforce. That survey also looks at views on vaccinations, staff testing, about finances, looking at how occupancy levels have changed. So we've tried to do a real state of the sector, as a way to continue to push this message out there and to really raise the profile of the sector's needs amongst the public and parliamentarians and the media as well. So I just wanted to provide an update on that.
Thank you.
And then this one for me is just wrapping up to show people, I'm sure if you're conscientious enough to be at a webinar on your Wednesday evening, I'm sure you're aware of this anyway, but if you go onto the Alliance website and go to the provider section, and then there's a drop down menu that says coronavirus, we have our updates. So it's just basically latest government guidance, latest advice, some of the things that Mel was talking about today in terms of EYFS changes. We update it constantly. So if a new iteration of actions for early years comes out, we are straight on it and update it. And we're always putting your queries to DfE and updating it on that basis too. So on a day-to-day basis, please do use that section of the website if you've got queries about government guidance.
Thank you, Shannon. I would, recognising what I can see in terms of the questions here, some of them are very specific and we can't deal with them now, but I do think from the last time I visited the Q&A page, a lot of the information is available through you'll be able to weave into your own personal circumstances because it is very comprehensive and is regularly up to date. So I would commend it to everybody. I think we're going to Melanie to bring us back and cheer us up.
Well, yes, what can I say? For me, I just wanted to finish by saying, you know, at the end of all of these updates, the guidance, the policy, the injustice of some of the decisions that are being made at the moment is all of you that are out there, all of you that are listening tonight, and all of you that will get up and turn up for work tomorrow and give it your very best. And there's so much to take in at a time when we're all working under such huge pressure. So I did want to finish on a more uplifting note. My daughter gave me this book. A lot of people have been talking about it. It's called The Boy, the Mole, the Fox and the Horse by Charlie Mackesy. And if you can just see the writing at the bottom, we all need a reason to keep going, said the horse. What's yours? Cake, said the mole. And I just wanted to finish, Michael, by just going to the last slide here and just saying, well, actually, this is our reason. That's what gets you all into work tomorrow morning and carrying on doing the fantastic job that you're all doing. And I think that's all I want to say, Michael, really.
Well, thank you both. Thank you, Shannon. Thank you, Melanie. That's been hugely informative. I am sorry, I am losing it a bit here in terms of the sheer volume of things going through my slides. As I've said throughout, my apologies that we've not been able to answer many of your specific questions directly. They are so focused on your particular circumstances. I would invite you to go to the website. The Q&A page is invaluable in terms of trying to interpret the latest guidance to your circumstances. I've also said that we've taken the commitment that we get a printout of all of these questions, and we will attempt, whether we can answer them all or whether we do a general circulation to everybody who attended as registered, because it has just demonstrated the sheer range of challenges that you're facing. But I think I would end echoing Melanie's uplifting words in the last two slides, that if nothing else, the pandemic has demonstrated the flexibility, determination and tenacity of the early years sector, notwithstanding all the confusion, the changes, and let's face it, some of the less than respectful approach that we've been presented with. You have kept going. You've kept your eyes on the important factors of the children and their families. And so I would just sign off by saying thank you all on behalf of the organisation, and keep it up. And we'll be back with you in a few weeks, no doubt, to update you on all the information that is there. Just my thanks to Shannon and to Melanie. Please say goodbye.
Bye, everybody.
Thanks so much, everyone, and promise we'll go through the questions afterwards and try and respond to as many as we can, just in case anyone's feeling a little.
And just by way to say thank you to everybody who's now saying thank you to us. That's been really kind of you. One of the first one, when I was able to track all the questions, Jackie at 1800, so started off, She started by saying a huge thank you to the Alliance for all your help, support, advice and motivation. It's a credit to the in-house staff we have, Shannon, Melanie and many others who keep on top of this on behalf of everybody. It's a real credit to them. They're a credit to the organisation. Go and enjoy the rest of your Wednesday evening, and goodbye. Thank you very much, everybody. Bye-bye.
Thanks so much.